A very good morning. Today I will be talking about periodontal ligament. So to introduce this topic, periodontal ligament is a investing structure where periodontium consists of two soft tissues and two hard tissues. So one soft tissue is gingiva, the other soft tissue is periodontal ligament. So the other two hard tissues are alveolar bone and cementum. Gingiva is totally covering the tooth, where it surrounds the tooth. It forms the outer covering of alveolar process, and periodontal ligament is inside the tooth, like it will be connecting the cementum and the gingiva over it. And coming to periodontal ligament is the connective tissue that surrounds the root and connects with the bone. So it is continuous with the connective tissue of the gingiva and communicates with the marrow spaces through vascular channels in the bone. So the average width, when you see radiographically, it is 0.2 mm only, not much. So you can see this periodontal ligament over histological slide, and this is alveolar bone. This is the tooth structure, this is alveolar bone, and you can see the cementum over it. Thin lining of covering of cementum. Over it, we can see the periodontal ligament space here. The ligament space is very narrow with a thin slides. So what forms the periodontal ligament? Periodontal ligament is formed by fibroblasts, where the collagen, the most of periodontal ligaments fibers are collagen fibers, where we can see the oxytocin fibers and ilenin fibers rarely in the periodontal ligament, as Fulmer described it as pre-elastin fibers, where when formation of periodontal, when the collagen is forming, there is oxytocin fibers and ilenin fibers in somewhat discrete condition in collagen where the collagen fibers are compressed like this in a 5 particular groups. One is alveolar crustal group, second is horizontal, and third is oblique group, and apical group where it surrounds the apical foramen, and interradicular group. They are present at the furcation area of it. So what is this alveolar crustal fibers? What is the function? The function of alveolar crustal fibers are, it counterbalance the force of apical fibers and keeping the tooth inside the socket. Even this horizontal fibers also do the same, along with keeping the tooth in the socket. Horizontal fibers stabilize the root, and these forms mass of gingival fibers along with the cervical enamel junction. They connect these two, so it is called alveolar crustal fibers. And second is horizontal fibers. These distribute from the apical region to the crustal region. Okay, and horizontal fibers, these form the bulk of cementum which connects the alveolar bone. So these are perpendicular group, and the third group is oblique fibers, where the largest group of fibers, these are present beneath the horizontal group, extending till the apical foramen, till the apical portion of it. So these take the alveolar occlusal forces, they transfer into the marrow spaces of the alveolar bone or the basal bone. So the fourth group is periapical fibers. These radiate from cementum to bone surrounding the apical foramen. So these are not formed in incompletely formed roots. And the last group is interradicular fibers, where they are present at the furcation area or the trifurcation of maxillary tooth or the bifurcation of the lower or mandibular tooth. These fibers fan out from the cementum to the tooth in the furcation areas of multi-rooted tooth. So Sharpey's fibers are otherwise called extrinsic fibers. These fibers are formed by periodontal ligament. The terminal parts of periodontal principal fibers, they insert into the cementum along with the calcification into the bone and the cementum. So that's why they are called Sharpey's fibers or the extrinsic fibers. They are not formed from the inside the ligament space or inside the collagen bundles. So what are the components of periodontal ligament? Periodontal ligament has components of cellular components and the extracellular components. These cellular components which forms the tissue, which forms the collagen and destructs the collagen. So these are synthetic cells, resorptive cells, progenitor cells, epithelial cells, and the connective tissue cells. And the extracellular components are fibers which are formed by these synthetic cells and the progenitor cells, and the ground substance which is extracellular matrix there. So the cells of periodontal ligament. So synthetic cells are fibroblasts, osteoblasts and cementoblasts. Fibroblast forms fibrogen, that is collagen, osteoblast the bone, and cementoblasts are cementum. These resorptive cells are fibroblasts which resorb the collagen which are dead, and osteoclasts which resorb the bone, and cementoclasts which resorb the cementum. These 6 cells are present in periodontal space. So the other endothelial cells which are present are cell rests of Malassez, which they differentiate into periodontal ligament in new attachment or regenerative procedures. So what is this extracellular matrix present? It consists of glycosaminoglycans, GAGs, which include hyaluronic acid, fibromodulin, keratin, sulfate and leucine, and glycoproteins include fibronectin and laminin. These form the extracellular matrix with the what you call the meshwork inside the extracellular matrix. So blood supply of periodontal ligament has blood supply of which are supraperiosteal vessels and vessels from the adjacent bone and the marrow spaces, dental arteries which they enter through the apical foramen. Through apical foramen, which the arteries which enter the apical foramen will supply to the periodontal ligament space, and the adjacent bone, adjacent tooth vessels also supply to the periodontal ligament space through the marrow spaces. And neural elements, where we can see the sensitization of periodontal ligament. In cross section you can see the mixed nerves present over here. This is tooth, this is the surrounding periodontal ligament. You can see the slides with new nerve endings there. So these are called mixed nerves in periodontal ligament. So magnified view of periodontal nerve, which consists of myelinated and non-myelinated, myelinated and blood vessels. We can see the vessels in a magnified view of that particular nerve which is present in the periodontal ligament. So main function of periodontal ligament in dentistry, if periodontal ligament is not there, for suppose we are not there, because periodontal ligament forms a casing of a particular tooth which is attached to the cementum or the bone. So provision of soft tissue casing to protect the vessels and nerves from the injury and from the mechanical forces. It protects from mechanical forces which are by the occlusal surface. So transmission of occlusal forces to the bone, attachment to the teeth to the bone, maintenance of gingival tissues and a proper relationship or the contour of the bone, a contour of the gingiva is also maintained by the periodontal ligament, and resistance to the occlusal forces. To be frank, it is trauma from occlusion, okay, and light forces, moderate forces and heavier forces which they take depending on the forces, the periodontal ligament act accordingly. So light forces are absorbed in the intravascular fluid and moderate forces are absorbed by extravascular tissue, and heavier forces are taken up by the principal fibers. The 6 principal fibers or the 5 sets of principal fibers, they take the heavier load when the occlusal forces are beyond 25 Newton. So coming in detail with the physical functions, resistance to the impact. So how this resistance to the impact is done by the periodontal ligament fibers. It is explained by 2 theories. One is tensional theory and the second one is viscoelastic theory. Tensional theory is nothing but the force, when force is applied, the ligaments stretch and they straighten up and transfer the forces to the alveolar bone casing, and they cause a elastic deformation of the socket. So finally when the alveolar bone reaches its limit, the load is transmitted to the basal bone. Once the sequence is like this, when the force is applied on the tooth, it will transfer to the periodontal ligament, then it goes to the alveolar bone and to the basal bone. So many investigations find this theory insufficient to explain experimental evidence, because it is a normal assumption that periodontal ligament fibers extend and retract to the particular place. So it is explained more clearly with a viscoelastic theory, where viscoelastic theory, the extracellular fluid comes into contact with the forces. So when the forces are applied, the extracellular fluid passes from the periodontal ligament to the marrow spaces of the bone through a foramina in the cribriform plate. So after depletion of tissue fluids, fiber bundles absorb and tighten. So this leads to blood vessel stenosis. So arterial blood pressure, ballooning of vessels, passage of blood ultrafiltrates to the tissues, and replenishing the tissue fluids. So when the force is retracted, the fluids escape into the marrow spaces. So the other functions are formative and remodeling. Formative is by fibroblasts. The cells of periodontal ligament participate in formation of and resorption of cementum and bone, which occur in physiological tooth movement, when the tooth is erupting. So the continuous process of tooth is eruption only, and in accommodation of periodontium to occlusal forces, that is to counterpart the trauma from occlusion, and in repair of the injuries. When there is injury to the investing structures, it forms a remodeling function to repair that injuries. So the periodontal ligament is constantly undergoing remodeling as cementum is continuously depositing its cementum on the predentine. So old cells and fibers are broken down and replaced with the new ones, and mitotic activity can be observed in the fibroblasts and the endothelial cells. Fibroblasts form the collagen fibers and may also develop into osteoblasts and cementoblasts. As I said earlier, these are differentiated based on the cell rests of Malassez. So based on the function, they differentiate into either osteoblasts or the cementoblasts. So for the formation of Sharpey's fibers or the investing fibers inside the periodontal ligament. So what is the sensory function of this periodontal ligament? Once the tooth has nerve supply and the sensory supply, even the periodontal ligament has nerve supply and a sensory supply by tactile sensory nerve fibers or the nerve bundles, which has three functions of tactile, pressure, and pain sensation. When the force is applied onto the occlusal surface of the tooth, we can see the pressure sensation. If the tipping forces of the periodontal ligament are seen, you can see the pain sensation when you slide the tooth inside occlusal or mesially or the lingually. And tactile sensitivity, it's normally when you touch a particular tooth, you can feel that tooth. So that function is normal for a tooth and a periodontal ligament. So nerve bundles pass into the periodontal ligament from the periapical area and through channels from the alveolar bone and follow the course of blood vessels. So nerve supply, it is explained by somatosensory system, where afferent nerve fibers reach the periodontal ligament, and these NV1 and NV3, where those are plexus from terminal branches of superior dental plexus and the inferior dental plexus before and during eruption. Other pass through canals of Zuckerland and Hirschfeld in the cribriform plate. So while explaining the viscoelastic theory, we talked about cribriform plate, where the forces are distributed into the marrow spaces. So these both group unite at the periodontal space at the nerve plexus. So to conclude, periodontal ligament as a structure, we see periodontal ligament as a unique structure where we can see the sensory functions, nerve functions, and mechanical forces where the tooth exerted by the occlusal forces. So with periodontal ligament, tooth stays in a particular socket and the basal bone. If it is impaired or if it is disturbed, we can see tipping forces, or there is pathological migration is seen in the periodontal ligament, or there can be tooth mobility there, where with impairment of the periodontal ligament. Thank you.